Dr. Nario is with Biointegrative Health Center in Reno, Nevada. As you know, if you've been watching us, they do all kinds of really cool treatments. Well, I think they're cool um, for all kinds of different ailments. If you guys want to reach out to me, you can get me at stevemain.com. This is another one of those topics we've been doing, performance enhancing drugs and other stuff. So we got the doctor here now to talk about SARMs, another one that's, people wonder about. So it is going to enhance performance. There's multiple kinds. And so I'm excited to have you on here to talk about this topic. So welcome, doctor.
Hi, Steve. Thank you for having me. Always a pleasure.
Okay, so tell us about SARMs. I mean, are they steroids? Are they not steroids? Or just give us a brief overview of what these things are.
Well, Steve, SARMs very common in the bodybuilding industry, and of course, you would hear these affiliated words such as cycling, stacking, and they all come together. And falling into the cat, they also fall in the categories of, as you mentioned, steroids, exercise enhancement. So these are kind of. I have a lot of patients who are broadly, I guess, misunderstanding what these terms are. But the common ones that you would hear, these are weird names: Austrian ligandrol, testosterone, andarine, and they can be coming in numbers also: MK2866, LGD4033. So many of these jargon, but they're all terms. The thing here is, let me speak about SARMs in the aspect of what I see in the medical context. So basically my clinical experience as I see patients. And this might be, of course, different in relation to the other authorities in this area. So SARMs are selective androgen receptor modulators. And these are compounds with similar anabolic properties, meaning building anabolic, catabolic is breaking, to anabolic steroids. That's why they're becoming interchangeable, but with the reduced androgenic producing, which is the production of male characteristics properties. So meaning the side effects of steroids are not found when you're using SERMs, but you get the effect of basically of steroids without the or less of the side effects. That's how they can understand it in the commercial world. And the analogy here is androgen receptor responds to binding androgens, like testosterone therapy binds to testosterone receptors. And again, the bigger thing to understand here, the difference with anabolic steroids is they bind to androgen receptors in a different manner in terms of tissues, meaning different parts of the body. Individual SARMs selectively bind androgen receptors in certain tissues, but not in others, meaning selective versus broad-based approach of steroids.
Interesting. So are you basically saying they're similar? So I'm assuming this would classify as a performance enhancing drug, and they're illegal if you're playing college football.
That is correct, and I'm going to go deeper into that statement as you just mentioned in a bit. But you're correct.
Okay, right. So that means it is enhancing. They have an anabolic effect on the body, um, and very similar. It sounds like it's just kind of a milder effect than anabolic steroids. So, um, what can the benefit be?
Well,
I mean,
again,
that's kind of a dumb question, I guess, but go ahead.
no, that's pretty logical, and I get a lot of those questions too. So, Steve, the comparison again, when you want to see the benefits, it's always going to go back to that comparison of steroids. So, the comparison of SARMs to anabolic steroids, and yeah, again, a better way to understand this is anabolic steroids in terms of effects are more generalized, meaning all over the body. It will give you all that bad effects when you take steroids: high blood pressure, again, the pigmentation lowers down the immune system if you take it for a long period of time. So basically, it's a shotgun therapy when you have all these side effects that you're talking about. But SARMs have only targeted effects. It's almost like you want to compare it to like targeted missiles, so that it's a more specific approach. And they target muscles directly, and not like the other holistic or systemic approach of like what steroids does. And reason why it's very popular in the bodybuilding world. And going into that medical setting, so SARMs are actually being studied and are useful for stimulating specific tissue growth like the muscle and the bone, and while avoiding unwanted side effects in other tissues like the liver or the skin.
Okay, so you're not going to have liver side effects or skin side effects. Is that right?
I mean, that again is one of the claims of SARMs. But again, as I mentioned to you, were different types of SARMs that are actually found to be affecting such organs. So that's why this is where your previous statement of prohibited, legal, or not legal comes into play.
Right, because I mean, anything that is even slightly proven to enhance performance is going to be illegal in any collegiate sport and so on, and certainly illegal if it's not prescribed by a physician, because this is a drug, right?
Well, it's actually when you talk about a drug is like you need a prescription for it, and then you get it from a pharmacy. So that's basically how we define it as a drug. And of course, when you say a drug, FDA approved it. But for this one, as far as the studies go, I haven't seen one that was approved by the FDA.
Right. So are you saying that someone could get one of these SARMs products without a prescription?
Yes,
How
there
do?
are actually markets out there that
Wow.
yeah, they can actually get SARMs. And again, that's the sketchy part about that. That the source, you have to know where the source is coming from. And majority of these SARMs really are again uh, unregulated, if I may say. Yeah, they have different forms: oral, injectables, you name it, they're out there.
Interesting. Okay.
Mhm.
Um, I did a thesis in college on steroids, and some of this stuff is new to me. Okay, so that's going to give me a few more questions. So, what are the side effects? There's side effects of putting something this isn't really natural that you're putting in your body.
Right.
So, what can some of the side effects be?
hmm Well, the thing here is with SARMs, there have been found in studies, these are in medical studies, that it had found to reduce endogenous testosterone, or the body's creation of the own testosterone or natural testosterone. It also affects cholesterol levels and alter liver function. It doesn't produce, the thing here is, so comparing it to steroids, it doesn't really produce addiction, but has the potential to be misused for performance enhancement. And in sport, in sports, due to their anabolic properties, as well as their ability to stimulate androgen receptors in muscle and bone, leading to bone and muscle growth, thus common in bodybuilding. So it's not addicting. The point here is the addicting part is you like the outcome. That's why you do
Sure.
it over and over again. And again, this is where FDA comes into play, that has warned consumers about potential life-threatening side effects of SARMs, including an increased risk of heart attacks and strokes. The long-term effects of using SARMs are still unknown. So these are one of the, I guess I'm paraphrasing the exact statements of FDA. And additionally, in the fitness community, SARMs are taken at doses and durations that are higher than those that are tested clinically. And the interactions of SARMs with other substances such as alcohol, other drugs, especially with their chronic use, particularly at high doses, remains unknown. And when bodybuilding comes into play, there's so many other add-on substances that goes along with it. The ones who use it, like they drink, they do drugs. I'm not stereotyping, but it just comes with the territory.
Yeah, amazing. And it is really like, especially on YouTube. And hey, if you guys have questions, put them in the comments. Put them in the comment section. I know this is a lot of people are like, hey, should I do this? Should I not do this? What's the pros? What's the cons? And um, I've said in other videos that, steroids, testosterone replacement therapy, SARM, none of this stuff is a magic pill. It doesn't work that way. It's not a magic pill. Uh, so now this is really getting me to this question, and I'm wondering. So let's say someone or you have a patient that comes to you who wants to do this. I'm interested on I know everyone's different and everyone's got different unique situation, but how would you, if someone's just insisting on this, how would you advise them? Would you say, um, can you write a prescription for this?
No.
No.
Uh,
Okay.
I mean,
So,
yeah,
but
there are ones out there that I know that are being worked on. Again, still in the research phase, that they're trying to make it into a peptide. So like,
really,
I think, yeah, I think MK is trying to get into the peptide world, and I have heard of it being, I guess, being used in the market as such. But again, right now it's so vague, and you know of the World Anti-Doping Agency, so they're actually not, yeah, they're not promoting this in relation to, of course, the use of for athletes who are competing.
okay. So you got a I'll give you a couple scenarios.
Mm.
You got a 21-year-old who is a high level athlete at a university, and he comes to you and he says, advise me, doc. Should I take these? Is it okay? And let's say it's your son. Okay, what do you tell him?
Okay, so now, I mean, regardless of whoever it is, son, friend, college classmate, SARMs is really still in question. The thing here is there's so many blogs out there, so many websites that are actually going to guide you through stacking, through cycling, and even if there's even like what we call your when you're it's like an anti-androgen phase. You're going to take an anti-androgen along with it. So this is how the bodybuilding world works. It's going to be a cycle about things. When somebody wants to use it the first time, it's not just going to be, hey, I have a date, I want to pump it up. It's going to be, hey, I want to use it long term. I want to be like this big because I saw this on a picture or my buddies like this. It's going to be long term. And again, as I tell, long term effects still not known. That's why let's not mess with drugs, or let's not mess up with compounds that are not studied yet until proven otherwise.
Yeah, that's great advice, and I would echo that. I would agree, um, because you know it's just if it sounds too good to be true, well, that's the old cliche, right? Um, so no, I think that's good advice, and I think that like I said, anybody has questions, go ahead and put them in the comment section. But we appreciate because I know that you've been someone who's been into exercise and building your body and this stuff. So you're coming from you understand it, and yeah, you start this cycle and you need this cycle to stop this, and now you got one drug compensating for another and undoing this and that, and before you know it, you got a mess.
Right. Well, Steve, there's light outside the tunnel also. So when you talk about SARMs now, there are actually clinical trials that are being made or done in relation to SARMs in treating like muscle wasting for conditions, pathological conditions such as cancer, end stage diseases such as liver failure or kidney failure. And all of these are what we call like losing bone, I mean, losing muscle, losing the thickness or the conductivity of our bodies. And again, these are all research, though, unfortunately. And quoting FDA, that to date, all SARMs are still investigational and only for purposes of such research only. And the thing here, they can only be sold for such purpose, but You will see them being sold through websites as dietary supplements. So be careful in what you guys are looking out for.
Yeah. And yeah, yeah, be careful. That's good advice also. And steroids were invented for a reason, and that reason was not vanity, right? The reason was, I think, for people with muscular dystrophy and muscle wasting problems and issues like that. People that have growth issues and so on. So there's a reason for them, but they've been used for reasons that they weren't intended, probably, right?
Right.
Okay, well, thank you, doctor. That's Dr. Nario, Biointegrative Health Center in Reno, Nevada. And we appreciate your broad range of knowledge. And I come to you for a lot of things, questions and so on. And you're usually in the ballpark, which is good. So thanks for being with us, doctor.
Uh, Thank you again, Steve, for having me. And as we all know, knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.